Now, a common question is, gosh, is it transfer of one embryo? What does it mean to transfer two embryos? So from the outset, I want to state that the safest and the healthiest is transfer of one embryo. But I am one of the few doctors left that will transfer two. And I will tell you why after. Let me go over all the risks. Number one, when I transfer two embryos, there is no guarantee of twins. At our clinic at San Diego Fertility Center, half the times when I put in two, only one implant. But let's think the other extreme. There is a 3% chance that an embryo can split in your body once we've transferred. So I transfer two, and then all of a sudden, there are triplets. Because one embryo split. That means you have one set of look-alike twins and one that's by itself. Now, the problem with look-alike twins, that means it came from one embryo that split. That means it's pretty rare. I've seen it, but it's pretty rare that you can separate them and take one of the identical twins away. I have had a patient where they were able to do that. It really depends on how early they separated. Let's assume that you can't do that. If you carry triplets, it's highly, highly risky. So we will recommend a selective reduction, which we can't force you. It is just a very strong recommendation, which is you go to a specialist. It's a very quick procedure. You're wide awake, and they will reduce the triplet pregnancy, either take away the one alone, so you're left with a set of look-alike twins, or take away the look-alike twins and you're left with the one embryo, with the one fetus. But let's pretend you have twins. They're not identical. They came from two separate embryos, so two separate sacs. There are some intended parents who would love to work with you because their heart is set on twins. So that would make you a very desirable surrogate candidate. But understand that your risk for diabetes and high blood pressure is higher, even if you've never had a history of this in your past pregnancies. The fact that you're carrying two in and of itself increases your risk for diabetes and high blood pressure. You're also at increased risk for bed rest, right? So if you have a job and you're moving around a lot, like you may notice, oh my gosh, I'm feeling these slight tightening of my uterus, which are probably contractions. And so your obstetrician will likely put you on bed rest. And so think about what that means just in terms of your job. Can you go out on disability? How many kids do you have at home? Are they older and pretty self-sufficient if you're on bed rest, or are they quite young? Can you afford to be on bed rest if you have little ones at home that you have to take care of? Okay. Again, this is where family support will really be helpful. Twins are higher risk for C-sections. And a lot of surrogates I know really pride themselves on the fact that they've had all these vaginal deliveries, but your risk for delivering by C-section is much higher when you have twins. The scariest factor, though, of course, is premature delivery. So most twins deliver a month before their due date. So due date is at 40 weeks, and many twins will deliver at 36 weeks. And believe it or not, because the twins share a uterus, the stress of that really matures their lungs faster. So most twins are fine at 36 weeks. They usually don't need to go to the intensive care unit called the NICU, and they're fine. The problem is, okay, what if they deliver not 4 weeks before their due date? What about 6 weeks before their due date? What about 8 weeks before their due date, et cetera, et cetera? The earlier they deliver, the less mature the babies are. Not just the lungs, but every organ in the body, heart, lungs, eyes, intestines, name it. So the more premature they are, the greater the potential risk for medical complications in the premature babies. So this is a very important conversation for you, the surrogate, to have, and you, the intended parents, to understand. So why do I still transfer two? I've been doing this 20 years, and 20 years ago, we never put in one embryo. The IVF success rates were so poor that it was very common to transfer multiple embryos. So it's something that I'm very accustomed to. It's something that does not scare me. And most of my twins have done fine. However, you do this long enough, absolutely, I've had cases where I've had twins that have not gone well. Thankfully, that have been the minority of my intended parents. So for that reason, I do support transfer of two embryos, but only after all involved parties have been informed of what does it mean, what are the risks of transfer of two embryos. And as long as all involved parties agree to the risks, their potential, but they can happen, then I'm fully supportive of the decision to transfer two embryos.